Hello, good evening, and welcome again. I am Dr. Sridhar, and we have with us again a very special guest, Dr. Pradeep Suryawanshi. He doesn't need any introduction, and he has contributed a lot to your learning through my channel as well. So, obviously, he is a pioneer in the POCUS field in India, and he is in the Bharati Vidyapeeth Professor of Neonatology. He trained in India and Australia, and he is one of the few who came back to give back to this country. His passion for teaching comes from his father, he said, and he maintains a very high level of engagement with the students, the Gurukul system. So, Dr. Pradeep, I mean, welcome and thank you so much for the great effort you're putting in. And I should congratulate you and your team. You got the 100th publication. That's really amazing.
Thank you. Thank you, Sridhar. I think we both are on the same track. You started this channel, and through channel, you are educating not only the medical student, but the parents. And probably my side is I'm concentrating on mainly the newborn focus part. And thank you for inviting and have a discussion. Thank you.
I mean, the main reason we thought we'll have this chat, I mean, I know I have shared your lung ultrasound videos and also the hemodynamics based, I mean, the approach to shock and things like that on my channel from before. And I know you are an amazing teacher. I had the personal experience of attending your lung ultrasound workshop when you came to Dubai.
Yes.
And above all, you are so humble and a genuine human being as well. So the publications are obviously a niche area because you are contributing what you are doing and sharing different aspects. So do you want to say something about your research?
Yes. What is actually important for all of us as team members? I believe that we have maximum number of patients in India. Now, as a neonatologist, these are the three areas mandatory for all of us. Naturally, the ventilation, hemodynamics, and research is mandatory. Now, why I'm trying to say the research? Because unless and until we have our own data, definitely our situation or our standards won't increase. So this is the reason why, another reason why we started thought process about training the people with the same thought process and then making multicentric areas. And that's a plan. Now, the first plan was naturally my team, and already that team is working in a good shape. Now, we are training a lot of medical schools plus the DRNB centers where they are on the same platform so that we can have a link as a multicentric trial. I'll just give a simple example now. Now, we all diagnose very easily pneumonia by lung ultrasound, which is not so common in Western people. But now, how much time that pneumonia takes to resolve by lung ultrasound, no one knows. So if we combine these 10 centers, and if you have around, let's say 25 patients per center, you get immediately 250 babies in a span of hardly 3 to 6 months.
Yes.
So that's a thought process for me is a research ideas. We have plenty of research idea. I'll just give another example now. As the BRAT score, we all do the 6 regions lung scan.
Yes.
Anterior and lateral. But if you don't do the posterior scans in Asia, Africa, you are going to miss posterior basal pneumonia.
Right.
What is my observation? That's a paper is in pipeline with Nadia from France. That maximum pneumonias are in a basal region, and that will be picked up by posterior scans. So if I don't do the posterior scan, I will miss those pneumonias. Hence, that's another multicentric thought process in our mind. And that's the reason why we are training on the similar platform, all the people, so that we can go ahead in this direction. And as a neonatologist, we all feel that training and research goes hand in hand. So that's very important.
I don't know if you are following some colleagues on Twitter who are debating whether the medical school should separate the academic interest students from the beginning from those who are only going to appraise papers and practice. I mean, obviously you do need a basic knowledge of review of literature, appraisal of journals and so on, but the actual research that you and Srinivas Murki and colleagues, similar colleagues are doing is only for, I mean, it's not the cup of tea for everyone. So I, for example, never had an interest in actual research. I have interest in learning and disseminating knowledge, but not in actual research. And you can segregate it, but once you have that interest, you need a mentor like you to direct and also to practically execute. And you're right. I mean, the caseload in India is so high that you can be leaders in the world in certain areas of the field
Yes.
you're choosing. I think because yeah, they can
what I
collaborate.
want,
Yeah.
what I can tell the people now is all of us, we know that neonatology is our core subject. But in neonatology, we all need to select one area. Suppose now you have selected area of, naturally, neonatology is a core subject, but you have selected teaching, training as a one area.
Yeah.
Similarly, in future, students have to select, suppose neonatal pulmonology, neonatal hemodynamics, neonatal POCUS, neonatal infectious diseases, neonatal neurology, neonatal hematology. We need to select one of the area.
And excellent.
In that one of the area, we need to concentrate our own local research.
Yeah.
Means our local research, we don't require too many very high-fi, okay, RCTs and all that. We also need observational studies to document in the world that this is a prevalent in our area. This is available in area, then it goes forward. So yes, a lot of good institutes. I think India is doing good in research now. In the last 15 years, you already mentioned the Srinivas, Dr. Kabra or Somshekhar, or the people are doing a good research now. So if we concentrate along with our academic training, all the people will not be interested in research. And I'm not saying that if 100 DM people pass out and 100 will do the research.
Yeah.
Out of 100, even 5 people are gone into that field, we are in good shape. That's thought process from my side.
Thank you for that. I mean, coming to your teaching, I mean, you have different components, and I mean, obviously, it's hard work. You mentioned that you have a lesson from like 8 o'clock to 10 o'clock almost every night. And you also bring students, you are bringing a training institute. In addition to their coming, you're planning to separately construct a training center. I don't know if you've finished the process, but do you want to have a slideshow of to explain what exactly?
Yeah. Just let me share.
Yeah, please. I'll make.
Can you just make? Share. Yeah. Can you make a host?
Host. Yeah. Yeah. Please go ahead.
Yeah. Okay. My slides are visible?
Yes, please. Yeah.
Yeah. So what I just want to highlight, I think we all know about the COVID times. And the COVID times, basically, 23rd of the March, the lockdown started. And on the 1st April, I have taken a first session on the brain USG for all over India. And then we realized we can teach online. And that's the motto. We started as a 6 months course, which was the first sort of course in the world as a Neopocus. So this was the course which we started, and we actually have basically the theme was sharing is caring. So if you see this thought process that we need to reach this knowledge of POCUS to all the parts. I started my journey in 1996 with a knee cartilage ultrasound after giving ciprofloxacin in sepsis. That's where I started the journey of POCUS. In Sydney, I learned the echo and brain. Then we continued our process of learning. When I came back to India, we learned lung ultrasound. We continued learning gut ultrasound, lines, now liver ultrasound. So this is the area. What we are saying that we do conduct this 6 months course. And in this 6 months, we cover basically first 2 months brain and lung. Now you will say that what are their brain and lung? We actually complete 20 sessions of a brain and lung. And the sessions are 2-hour sessions, twice a week. The sessions are designed in that the first hour, we actually do the peer review. What is the meaning of mentorship or peer review?
Pradeep, you're still on the first slide. Is it?
Pardon?
Were you planning to display the second slide or it's still on the first slide?
Oh, so slides are not moving. Okay.
No, it moved, but moved back.
No, this is sharing is caring is a slide.
Yeah,
What?
now it's duration. Yeah, now it's a course.
Yes, that's fine. So what we have decided that we usually conduct actually these sessions, which are the 2-hour session. These are 9 to 11. And the first hour I called as the mentorship. Means whatever you learned in the previous class, you go back home, you practice, you prepare your PowerPoint, and then you show those presentations to me, and I comment what mistakes you're doing. What are the correct things are there? And the second session is the second hour where we learn only 6 points. The most important aspect of the learning is that we should not learn too many things in one day. We should learn 5 to 6 points. And those 5 to 6 points, in the next session, there are 10 times revision. The theme of the training or the focus is multiple revisions. Then ultimately it has multiple aspects of the people who share the knowledge. If you see what we do here, we have almost 20 sessions of the brain and lung, almost 20 sessions of the echocardiography, 10 sessions of hemodynamics, and I must proudly say that we have introduced the new concepts of kidney focus, liver focus, and the hip focus. These are the 3 focus which we are going to give the thought process to the world. The brain focus is there since 1990. Echo is there since 2000. Lung came in the picture in 2010. The gut 2015. Lines again 2010 onwards. But now we are introducing liver focus, and that's the article accepted. And just I told you that that's 100th article by my team. Once it is published, I'll share all of you. So this is the program which is designed over the last 25 years. 6 months program. Every Tuesday and Thursday, Indian time, 9 to 11, we are religiously doing that. Starting 9 o'clock is fixed. End point 11:30, it happens. And we have Indian Gurukul system. What is the meaning of Indian Gurukul system? It is coordination, communication. It is not one way. It is a lot of discussion. And we believe that attendance and homework or assignment is important. Every person has to do assignment. Then and then, this is helpful. A lot of people are saying how we are learning ultrasound online. This is the only course in the world which has changed the thought process that we can learn online. And this is the chair I'm sitting for last 5 years. Every night 9 to 11 as this process, and it's a proud moment for me and for my team or for my members. What I usually want to tell you, I would like to show you a few important things that we have now reached to the 30 countries of the world. This focus we started way back in 2020, and you will see that yes, naturally Indians are the more in my course, but the consultant from US, UK, Canada, Australia, they also join and they are learning. Middle East, Asia, African countries, Southeast Asia. And proud to say that now you can see this map. These are the countries which are involved in the POCUS spreading. This is my India, where we have reached almost all state except Ladakh. This is my state, where almost all districts except Gadchiroli. So our aim is to reach tier 2 cities of Asia and Africa, where facilities of immediate bedside ultrasounds are not there, immediate radiologists are not available, immediate cardiologists are not available. Our aim is not to become radiologist. Our aim is not to become radiologist. Our aim is focused, bedside, immediate thought process to diagnose and to improve the outcome of these babies. And by this, now we have reached 750 members. So this is the largest cohort in the world where we have trained 750 members. This is the first batch, merely started with the members of 30, which has now next batch 40, next batch 50, next batch 75, reaching to the fifth batch around 100, sixth batch around 100, seventh batch around 100, and eighth batch around 110. And that's how this Neopocus has spread. So these Neopocus members, they requested me to concentrate on general basic neonatology also. And that's where we also concentrate mainly the areas of Asia and Africa, where basic neonatal facilities are not there. We have concentrated on the basic course, which is called Neopulse. And we also trained a lot of pediatrician for very basic stuffs. What is the basic stuff? Theme is less is more. Because if we do less things, we get more outcome in neonatology. And we concentrate on the 10 areas. Less ventilation, more non-invasive ventilation, early extubation, maximum CPAP, early feeding, less TPN or minimal TPN, single antibiotics, less antibiotics, avoiding broader spectrum antibiotics, less lines or removing early lines. On this less is more theme, we train the people, and that has also reached to the various parts of India. And that also we have trained almost 13 basically now. These are the 550 members, and total training component in the last 5 years, it has reached to 1,500 members. One of the important aspect in my own life, I always wanted to guide a lot of NICUs, always wanted to train a lot of people. Hence, I concentrated in India. Now we are training the people from Nepal and Myanmar for upgrading the NICUs. And these are the NICUs where I am mentoring in India. You can see the members from various parts of the India where we have mentored. Those who are interested, this is my journey of the incubator post, or about mentorship, about the POCUS, and about the various thought processes which we work out in day-to-day practice. So those members, what is my theme is that we all have to learn new habits. We all have to accept newer technologies. And definitely, clinical part is going to remain there. Clinical neonatology is always there. So along with clinical neonatology, as inspection, palpation, percussion, auscultation, insonation is mandatory. Especially brain, lung, liver, lines. Very easy, very simple. Please learn. Don't hesitate to learn new things. Echo takes more time. Echocardiography takes more learning, more patience, more practice. But brain and lung and the lines and the liver, very easy, very simple. And as a pediatrician, we all can contribute more. So friends, this is what we have done in the last 5 years of the COVID times. about the what I called Indian digital neonatal Gurukul system. And a lot of people have helped us. A lot of people have given a lot of suggestions. If you also any suggestions, please send email or WhatsApp to me. Always happy to revise the plan. Always happy to improve the plan. That's what is happening. So
maybe you can stop sharing the slides.
Yeah, Sridhar, that's why I thought these are the points I wanted to cover.
Amazing. Yeah, it's very helpful, and the Neopulse obviously is a very good concept as well. So you're covering less is more, and I think you have covered all the topics in neonatology. So most of the students in Neopal are those from the Neopocus as well, or the POCUS group, or?
No, actually what happens, 10% people of POCUS or Pulse jump here and there, but
Neopulse
the
has more
Pulse,
take, yeah.
Pulse is mainly designed for practicing pediatrician.
Yes.
Very simple thoughts, very simple protocol based.
It's
Please
like
do this, please do that, please do that. Nothing related to research in the Pulse. It's just very simple and no diversion there. While the POCUS is mainly designed for high-end level, where a lot of teachers, DM neonatology teachers, DM people, people with a big NICUs,
yes,
they are attending. So this is what happening at present moment.
You cover how they cope in resource-limited settings, because most of these practitioners, no, not the POCUS ones, the Neopulse ones are probably practicing in resource-limited settings.
Yes,
and
yes.
You're able to give them tips on how to cope with the situations.
Yeah. But, basically, what I realized, I must say that the African people, they need a lot of help.
Yeah.
So actually, I have members from Ghana, Zambia, Tanzania, Kenya, Zimbabwe, South Africa, and they are very good people. They are such knowledgeable people.
Have you been there physically?
No physical. Everything is online.
No, not yet. You have not been there to explore how it works there and stuff.
No, I not been to there at all. Means actually, what happened? I'm enjoying, and they are also enjoying. So the travel component is part has reduced. But in future, recently I went to Philippines, and in the Philippines I have taken a session for 100 neonatologists. And they said that, okay, this is sensitization session, but we need more learning. So the sessions, 1 day, 2 days, workshops are sensitization. What I realize, or you all know that, workshops actually don't, you learn that day and after 7 days you say, oh, it's not happening well. In the POCUS workshops. Hence, it is continuous learning. So similarly, what I have done in the Myanmar, or I have done the Philippines, that I have sensitized them, and I told them that those who really wants to learn, those who really wants to take forward, please join. Then we'll take you forward. For the 9th batch, I have member from all these Philippines members. So that's how it is happening. Now I'm going to the Vietnam. So I'll spread the sensitization part there. I'm also going to the Muscat, Oman in November. That's what I do, visit 1 day, 2 day for just sensitization situations.
Very good. And you said you cut down on your clinical work in the evenings mainly to focus on this.
Yes. I think you all know that clinical work and this doesn't go hand in hand. We have to sacrifice somewhere. We have to accept that part.
We also see the feedback you get from your students, and it's often amazing feedback always. So congratulations on all the great work you're doing. And I think, this session will help sensitize people to keep learning. And the Neopulse or the less is more option is going to help many. I think it's not costly, isn't it? I think you're charging.
No, it's not costly. Basically, what happens, the developing country people, we have kept minimal fees because they are the one who are getting beneficiary for that. While the Indian consultants, I said, okay, you guys are in the better shape. You bear the cost. That other members, the cost has kept purposefully low because I think we need to take them upwards. That's what thought process on the Neopulse also.
That's how it's
and
yeah.
So those who are interested, I think my email and mobiles are with the
we'll be sharing the video
with the previous videos also, and here also there. We can always contact. And Dr. Sridhar is basically he's been very kind. He has he has been always with last 4-5 years. We are discussing quite a lot on this online teaching, online learning, and now Sridhar has reached to 50,000 people. That's a very wonderful thing. Recently, last week I saw that.
Yeah, thank you.
And my target is reaching 2,000 POCUS member. His target is 100,000 people reaching. So that's what is
You may
that's
reach
what
the
is
same
our
time, hopefully. Thank you, Pradeep, for the very nice
thank you.
discussion. I will share this soon. Appreciate your time.